Hello everybody, my name is Chaya Nanjundeswaran, and I'm going to be presenting on the topic measuring and monitoring the complex nature of vocal fatigue. Before I delve into the topic, I would like to thank Dr. Nancy Solomon and the Voice Foundation for giving me an opportunity to be part of the vocal fatigue panel in this year's virtual voice symposium. I have no financial disclosures related to the content of this presentation. For very good reasons, we are all staying home for COVID-19. I hope everybody is staying safe and healthy during this time. And here I am with my two little kids. Have anybody experienced caregiver fatigue or mom fatigue or even vocal fatigue staying home at these times? I, for one, sure has experienced mom fatigue. But today the focus is not on mom fatigue, but we're going to focus on vocal fatigue. An overview of today's presentation, we're going to talk about the review of measures of vocal fatigue, the effect of task versus physiology of vocal fatigue. We're going to revisit the definition of vocal fatigue that has been presented by Dr. Hunter in terms of redefining vocal fatigue. What are the current outcome measures, the framework to understanding the measurement of the symptom of vocal fatigue, and future directions. Before we delve into the immense literature that we have on the topic of vocal fatigue, I want to put out a disclaimer here that for the initial part of the summary of the literature review, I have not cited all of the references on my slides, but all of those references have been provided at the end of my slides in order to give due credit to all of the authors that have contributed to the understanding of vocal fatigue. So we're going to tease it out today to understand vocal fatigue in terms of how participants were recruited, what kinds of tasks were used to understand vocal fatigue, and what are some of the outcome measures that have been studied to understand the concept of vocal fatigue. When we think about our participants have been varied across the multiple studies that have been done for vocal fatigue. Specifically, we have looked at individuals who are vocally healthy and tried to experimentally induce vocal fatigue in these individuals to study the outcome measures of vocal fatigue. Or traditionally, we've also taken individuals that present with complaints or without complaints of vocal fatigue, but those studies we also need to pay attention to how vocal fatigue was defined and what kind of criteria was used to recruit individuals with and without complaints of vocal fatigue. And studies have also recruited vocally trained versus untrained participants in terms of understanding this broad concept of vocal fatigue. But now let's delve into the task, because one of the main things traditionally that's being done in our vocal fatigue literature is to induce the laryngeal system to experience this symptom of vocal fatigue. So the vocal loading task, which now we actually think about and have redefined or recoined the term in Hunter et al.'s paper, is to look at a vocal demand which is the communication scenario. So when we look at the vocal demand, and here we're going to use vocal loading task, because that's how traditionally we've looked at it in the literature. We manipulate the task either in terms of intrinsic factors, extrinsic factors, or individual factors. So specifically, when we look at intrinsic factors, we're looking at the duration of the task, the type of the task, whether it's reading or singing task, or the loudness of the task, and even manipulating the vocal quality. When we look at extrinsic factors, the manipulations have been either in association with intrinsic factors, looking at the experimental condition, whether it's in a lab or a clinical setting or in a real work environment, the ambient noise, the room acoustics or humidity, and also looking at individual factors like their age, male or female. Specifically, most likely females have been included in most of the studies, but other studies have also used males and females, and also looking at their profession. When we look specifically at the intrinsic factors that have been manipulated, the task itself is at question. We're looking at whether there was a prolonged reading task that was used, whether it was a vowel task, repetition of a vowel task, if there was singing task used, or alternating tasks. Difference between using the load is going from a higher pitch to a lower pitch or a louder volume. So that itself is the task. So what kind of task was utilized? How long was the task in terms of the duration? Tasks have varied anywhere from 3 minutes to 3 hours and 45 minutes. And sometimes here, certain studies have asked the participant to stop when they start feeling certain self-perceptual symptoms, while other tasks have said, no, every person has to read for 2 hours or 3 hours, depending on the duration of the task that was intended for the study. The intensity levels have been manipulated, either asking them to read at conversational loudness or at a loud voice, or the individual intensity variation. The intensity was chosen per specific individual to complete the task, or even manipulating the kind of voice type they've used, the non-habitual speaking task, like using a more pressed voice or a deeper voice. Now, we're also looking at manipulation of extrinsic factors. So these factors have been manipulated in addition to or in combination with the intrinsic factors, and they've included room acoustics or reverberation, ambient noise, asking somebody to talk at a loud volume in presence of a multibabble noise, humidity levels to induce surface hydration, or even manipulating systemic hydration, giving participants either to drink water or not drink enough water. So all of these factors come under the extrinsic factors, which can be manipulated as well when trying to induce vocal fatigue in an individual. The other concept that we have to look at are individual factors. And we look at these individual factors, we have always manipulated the age, whether they're male or female, like in terms of their gender, or we're also looking at their profession. But sometimes we also need to look at, when we're looking at the task, how did the individual sleep, or what is their personality, what is their generalized fatigue, or other psychological factors like mood or motivation to complete the task. Those can also be influencing the perception of fatigue during these tasks. Now, I do want to point out here that Fujiki and Shiv Shankar have done an excellent review article on vocal loading tasks and its impact on the outcome measures. So that's something for you to look at. And what I provided you was a very brief summary of vocal loading tasks. Now, when we look at these, in addition to the task, we have to look at what kind of outcome measures have been studied in order to understand vocal fatigue. So we're looking at a vocal loading task, and these outcome measures have been taken either prior to a vocal loading task, during the vocal loading task at different time points, and at the end of the vocal loading task. And some of the outcome measures, just to give an idea, have been capturing self-perceptual measures, auditory perceptual, acoustic measures, aerodynamic measures, what do the vocal folds look like, visual perceptual, physiological measures, and respiratory measures. Just a brief overview of these are going to be covered in the next few slides. So when we do look at that demand or the communication scenario that a person is posed in, we're looking at how does the person respond to this communication scenario. And the goal has always been to see if there is an induction of vocal fatigue following these tasks. So if we look at self-perceptual measures, there have been a variety of measures that have been capturing what happens post loading a system. And we have captured the perceived phonatory effort or ratings of perceived exertion using the BORG CR10 scales. Effort in general has been captured, discomfort, fatigue, how tired your voice is, either using a visual analog scale or using the VFI, or even voice symptoms or symptoms, feelings of muscle soreness, dryness, pain, tickling. So a variety of self-perceptual measures have been captured pre and post vocal loading task. And what we have identified is that self-perceptual measures have been sensitive to the changes of the vocal load or the demand that has been placed on the system during these vocal loading tasks. Other measures of auditory perceptual is to see if there's been any changes in vocal quality, either self-perceived by the individual saying that I do notice change in my vocal quality, or by an experienced research, the SLP, that is rating their vocal quality, and changes have included either breathiness in their voice, hoarseness, or roughness in their vocal quality. Acoustic measures, this has been one of our significant measures that has been studied in terms of pre and post vocal loading. And we're looking at fundamental frequency, intensity, jitter, shimmer, noise to harmonic ratio, CPP. This is just to name a few in the vast amount of acoustic measures that have been collected in order to understand this concept of vocal fatigue. And specifically, fundamental frequency and intensity have shown some measures that are of higher fundamental frequency or maintaining a louder voice following the vocal loading task. But most of these measures like jitter, shimmer, noise to harmonic ratio have been very inconclusive. Some studies showing differences, some studies showing no differences. CPP has been captured in a couple of studies to understand vocal loading and vocal fatigue. And again, those results have also been inconsistent. Aerodynamic measures have included using obtaining phonatory threshold pressure and airflow measures. Phonatory threshold pressure has been one of, the PTP has been one of a sensitive measure like the self-perceptual measures to capture any changes post-vocal loading even after 15 minutes of vocal loading. Visual perceptual measures have calculated or have looked at closure, glottal closure, looking at if there's a spindle-shaped glottal closure, if there's an anterior chink, a posterior chink. Changes have been noticed in the swelling of the vocal folds or the amplitude of vocal vibration as well, pre and post vocal loading tasks. Some of the physiological measures that have been captured are surface EMG, oxygen consumption and recovery in oxygen uptake kinetics, and excess post-exercise oxygen consumption. That is depending on those metabolic measures that have seen a change with 5 minutes of reading in conversational volume and loud volume. Maria Dietrich's work on using surface EMG has correlated an algorithm of measuring the electrical, the EMG response of these muscles, surface EMG response of these muscles to VFI factor 1, and they've noticed some correlations based on the algorithms to predict if student teachers have complaints of vocal fatigue or not based on the factor 1 on the VFI and their algorithm on the surface EMG. And I can tell that my brain, the mom fatigue, comes in and goes in terms of word finding difficulty. But anyway, let's move on. Respiratory measures, where what measures have been captured are in terms of pulmonary function and the lung volume parameters. And what was noticed in Hunter et al. Study with pulmonary function was that when they looked at the raw values of the pulmonary function data set, they correlated with the VFI factor 2 results in terms of fatigue. But when they normalized this data to height and weight, they did not see this correlation between changes in pulmonary function and VFI factor 2. Well, the lung volume parameters in the Shiv Shankar's group study, they noticed that there was only a change in the person vital capacity per syllable after a loading task, but no other changes were noticed in terms of lung volume initiation or termination in other lung volume measures. So what do we know? That was a brief overview of all of the studies that's been done contributing to the literature of vocal fatigue. But we can summarize here saying that we've recruited varied participants. We've used a variety of vocal loading tasks that is placing a demand on the system, and we're manipulating either intrinsic factors or extrinsic factors with some manipulation of the individual factors. There's a lot of the outcome measures that have been captured with everything that we've discussed, but more sensitivity was seen for PTP and self-perceptual measures that have better correlations to understand this concept of vocal fatigue than any of the other measures that have been studied so far. So there is a lot of mixed inconclusive literature in terms of that outcome measure and the task that's being used to study the understanding of vocal fatigue. So when we did talk about this vocal loading task, we said that we're measuring the vocal, or we're capturing the vocal demand. A communication scenario is presented to the subject, and there are adaptations or adjustments that are made by the system in order to meet the demands of that task. And so the question then arises is, are we capturing a vocal demand response, that is the adjustments that the body makes in order to meet the demands of the task, or are we capturing an onset of vocal fatigue? So we need to kind of really think about, is it a demand response that these outcome measures are capturing versus the onset or the perception of vocal fatigue, which we know that the perception of vocal fatigue was better correlated using those self-perceptual outcome measures in most of the studies. So the gaps in the measures can be, one, we're looking at the choice of individuals with vocal fatigue. How is vocal fatigue defined? How are these individuals recruited, and what kind of criteria are used to recruit individuals with and without complaint of vocal fatigue? What kind of tasks have we used, and what are the outcome measures? And again, are we capturing that demand response, or are we capturing the true onset of vocal fatigue with these tasks that we have used and the outcome measures that we are indeed capturing post vocal loading tasks? All right, so let's revisit our current proposed definition of vocal fatigue. That is, vocal fatigue is defined as a quantifiable decline in function, and the function could be either in terms of performance or in terms of perception. And within perception, we have to look at whether it's a trait perception, the trait fatigue, or a state fatigue. A trait fatigue is fatigue that is cumulative over a period of time, while state fatigue is a fatigue that is experienced for a given vocal task performance at that point. And also to know that fatigue is very individual specific. So we're looking at performance fatigue, fatigability, perception fatigability, or perceived fatigability, and within perceived fatigability, we have to pay attention to trait and state fatigue as well. So looking at the definition of vocal fatigues, what are some considerations that we need to look into the measurement and monitoring of vocal fatigue? One is, first, we have to understand the difference between fatigue as a symptom and fatigability. So a person presents to us, a patient or a participant presents to us with fatigue as a symptom. That is something that they experience, and they say that they have an issue with the perception of how they can complete a task, and that's what they term it as fatigue. Fatigability is when they come to us, how do we measure that? And that is measured in terms of a consequence of the symptom, which is the rate of decline. A decline in the function is fatigability of performance, and the rate of decline in their perception to complete the task is defined as perceived fatigability. So we need to be able to identify or look at sensitive outcome measures to capture this fatigue symptom in terms of a decline in performance and in terms of a change in perception. So moving forward with these considerations, let's talk about what current outcome measures can capture these. So our perceived fatigability, we again need to kind of categorize them into trait fatigue, which is fatigue accumulated or extended over an extended period of time. And state fatigue is experiencing that exhaustion or tiredness for a particular task in question. We also need to kind of think about that this trait and state fatigue can be influenced by individual modulating psychological factors like expectations, mood, or performance feedback, pain, or even their individual personality, being extroverted versus introverted as well. We'll talk a little bit more about these individual modulating factors as we come into our future directions. What we have currently for something to capture trait fatigue is the vocal fatigue index. It is a measure of trait fatigue. This is going to capture your symptoms over a period of time. How do you feel? The index has 19 questions. It has 3 factors. So within this latent trait of vocal fatigue, of the 19 questions we had, we could categorize it under 3 factors. The first factor has 11 items and is looking at tiredness and avoidance of voice use. The second factor has 5 items, which is specifically focused on physical discomfort right here in the neck area, throat area. And the third factor has 3 items that focuses on your symptoms, whether they improve or don't improve with rest. This is the current version of our vocal fatigue index, and this is how the instructions are given. These are some symptoms usually associated with voice problems. Circle the response that indicates how frequently you experience the same symptoms. And as you can see, part 1 or factor 1 includes all of those questions related to avoidance and tiredness. So my voice feels tired when I talk more. It feels like work to use my voice. I avoid social situations. When I have to talk more, I feel I cannot talk to my family after a work day. While part 2, I experience pain in the neck at the end of the day, or my voice feels sore or my throat aches. And part 3 is my voice feels better after I've rested. The hoarseness of my voice gets better with rest. Now these, the current scoring system of the VFI is you have to sum the total of each factor and not the entire VFI. One of the main reasons is that part 1 and part 2 are negatively worded, while part 3 is positively worded. So when you do look at the VFI scores and you're capturing it, you're looking at each individual factor total score versus a total VFI score. There is still some ongoing work that's going on with our VFI. We're looking at an analysis called Moken analysis. And within this analysis, we're trying to understand if there is a hierarchy of the items within the latent construct of vocal fatigue. Are certain items ranked more predominant in some populations versus the others? We have some preliminary data published on voice disorders, and we have presented some data on teachers. That's something that we will continue to look forward into developing more about the vocal fatigue index. And then we also are looking into validating the index to in teachers, because the symptoms that teachers may experience may be different or in a different hierarchy compared to a voice disorder population, which is where the VFI was first developed. Then we move on to, once we understand the trait fatigue, and that's very important to understand trait fatigue, because when we do bring our participant for a research study, we want to know what is the cumulative fatigue versus capturing state fatigue, which is for that task in question or the task that they're going to complete during that period of time. So when we do look at state fatigue, most of the times what we have used in the current literature is looking at ratings of perceived exertion. Now, exertion is how difficult or is to complete that activity for the task, how strenuous or how much effort it is to complete a given physical activity. That is in terms of physical exertion. That's how it's been defined in the fatigue literature, I mean, in the exercise physiology fatigue literature. But we're also looking at state fatigue, which is exhaustion or tiredness. So synonymously, we've been traditionally using exertion for state fatigue. So, and then there is a BORG scale CR10 that I will present, but we need to really start thinking about, should we look at a rate of fatigue scale or rating of fatigue that is going to capture the state fatigue. There's also been used, we have also been using global rating scales, which I'll present. And then there is a scale for singing ability, the EASE. So as I said, the BORG CR10 is currently being used across multiple studies to understand ratings of perceived exertion during a vocal loading task, or even capturing before and after therapy, how does their perception of effort. But as I said, this is being typically used to also capture that exertion during a vocal loading task, asking them to say how difficult was the completion of the task. One of the differentiations we need to understand when we do the ratings of perceived exertion versus state fatigue is that from the exercise physiology literature, ratings of perceived exertion is during the task. How effortful was it to complete the given task? And that will end as soon as the task is completed, right? The physical effort to do the task will end as soon as the effort is completed. But state fatigue may linger. Your exhaustion, how tired are you completing the task, may not end as soon as the task ends, but it might linger after a certain time. So that's one of the biggest distinctions between using ratings of perceived exertion and a specific state fatigue index or a scale, because we're capturing two different things. One is during the task, your perceived exertion, which should end after the task, and then your state fatigue may linger after the task. But I'd like to point out that this has been adapted for the voice literature by Ballner et al. And Van Leer and Van Mersbergen. And one of the things that they do indicate or emphasize is the importance of experiential anchors. That is to say that we want to anchor these ratings to something that the person has experienced. So 0 is when they use a resonant voice where there is no effort, very ease of voice production, where 10 is maximal vocal effort when they've experienced laryngitis and they can't really produce their voice. So they kind of talk about the importance of using these experiential anchors during getting ratings of perceived exertion. This scale that I'm presenting here has not been studied or tested in the voice literature to the best of my knowledge, but it has been suggested in the exercise physiology literature, again, specifically to delineate the concept between perceived exertion versus fatigue, state fatigue. And this was specifically designed to understand state fatigue. So this is food for thought for us to think about, do we need to think about a scale like this for fatigue to capture state fatigue for the vocal literature or vocal fatigue literature? Other things that have been used to capture state fatigue are visual analog scales, like what is the current level of voice-related fatigue during speaking or singing. This is on a bar with 0% no fatigue and 100% with severe fatigue, has been used in app by Van Staan et al. And also Voice Evaluate software also uses a very similar bar to capture fatigue on their app as well. Another question is, I'm able to sustain my voice at the end of the working day and never and always. So some of these visual scales are targeting that state fatigue concept. EASE is a scale that has been specifically developed for singing, and it has 2 subscales which monitors vocal fatigue on 10 items and pathologic risk indicators 10 items. Their main goal is to say how difficult it is to, or what do you feel at this moment. It's not necessarily during their singing, but at the point that they've finished their singing during that day, if they've completed the performance. So I'm not certain to say that this is capturing state fatigue, but this is something that has been established in singers to be able to capture how does the vocal health or their singing vocal health in terms of vocal fatigue and pathologic risk indicators. So that kind of gives us a little bit brief summary about what do we have existing in the literature for perceived fatigability. Now let's kind of take turns and look at performance fatigability. In order to understand performance fatigability, first our biggest question is we have to measure a decline in performance. That decline in performance could be a decrease in power, increased time to complete a task, decreased force production. So we need to understand in the voice world, what is the decline in performance ability. We also need to kind of be wary of the vocal demand response. When we do a vocal loading task, are we capturing the adjustments of the system to the vocal demand or the scenario that is given to the individual, or are we actually capturing the onset of vocal fatigue? So how are we measuring in this vocal demand the decline in function? So it is important to categorize that declining in the function. In order to do that, we first need to understand some of the modulating factors. So are we specifically capturing neuromuscular fatigue, or are we capturing tissue fatigue, or something related to metabolic issues? Then we do need to capture specific modulating factors and what is the decrease in performance for those modulating factors before we decide that we're going to capture performance fatigability. So experts from the exercise physiology literature give us some understanding into the influence of symptom of fatigue in human performance. So first, they do indicate that it is important to select an appropriate outcome measure that is modulated by fatigue. Then select an appropriate lab test that predicts the performance on the outcome measure. And finally, to design studies to measure the adjustments in the modulating factors that limit the performance in the lab test chosen. So take a step back. Let's put this into perspective in our voice world. We're looking at saying, first thing is we need to identify what is the factor that we're going to capture of modulating factor of vocal fatigue. So are we looking at neuromuscular? Are we looking at tissue fatigue? Once we identify what that modulating factor, or even in perception, are we looking at mood or motivation? We're going to identify first the modulating factor. Once we've identified the modulating factor, we have to choose a sensitive outcome measure to capture that modulating factor. Once we have the outcome measure, then we design a lab test to predict the performance on that outcome measure. Once we have that lab test, then we are going to design studies to see, are there going to be any adjustments during the task on that outcome measure that we have made changes to that is going to limit the performance. So it is a step-by-step approach that we really have to think about. Instead of saying this is our task and we're going to load the system and here are the outcome measures, we need to kind of take a look at it a different way and say, what aspect of vocal fatigue are we capturing, and let's design an outcome measure to capture that. Then let's design a lab test that is going to help us predict that performance on that outcome measure. So this is a different thought process, but there's a long way to go on this, so something to really think about for future measurement and monitoring of vocal fatigue. So food for thought here. We have to first understand the difference between fatigue and fatigability. Fatigue is a perceived symptom that the patient or the participant presents with. So that is what they come with. It's a self-perceived symptom. While fatigability is measuring the decline in performance or perception of the symptom that they present with. So it's a consequence of the symptom that we want to capture, either in terms of performance decline or perception decline. Given that fatigue is a self-perceived symptom, we need to pay a little bit more attention into self-perception or capturing the self-perception. So the tools like the trait and state fatigue may be the gold standard because we are capturing the self-perception of the fatigue. We have to identify modulating factors for fatigue, again, understanding what aspect of fatigue are we capturing, again, appropriate outcome measures to capture that modulating factor, then the lab test to capture the outcome measure, and to identify the essentials for those adjustments to happen, and also saying if those adjustments are demand response, and then are they then related to the onset of fatigue. It is difficult to pinpoint one single outcome measure that is going to be able to say that here is the outcome measure that is going to capture a performance decline that is going to correlate with the perception decline in fatigue. So we have a long ways to go, but I also want to point out here that Mary Sandage has written a very good article in ASHA Perspectives that has used the very same concept of performance and perceived fatigability and talking about how can we train our professional voice users using these two concepts in order to build vocal resilience and also rehabilitate these individuals to meet the demand or the vocal demand that we call in the vocal loading test. How can we train the system to minimize the impact of the demand on the onset of vocal fatigue symptoms? So I'll end here with this for us to think about is the framework as it applies to voice. It's been adapted from ANOCA. We're looking at the different modulating factors. I've just presented a few here. There could be many more that I have probably left out, but just to begin with, we're looking at performance fatigability. We're looking at neuromuscular modulating factor, tissue modulating factor, metabolic modulating factor, or afferent feedback or regulation. In terms of perceived fatigability, we're looking at homeostasis, where the body says, this is it. I'm going to stop speaking now because I don't want to do further damage to my vocal folds, or even other psychological factors like mood, motivation, personality, and pain that can cause a big influence on the perception of fatigue. So we really need to think about these individual modulating factors as it pertains to voice and the understanding of vocal fatigue to determine a good outcome measure that is going to help us capture the performance fatigability and perceived fatigability in individuals experiencing this condition. Here are my references, as I indicated that they are there at the end of the slide. This is a culmination of all this work that's been from all of the researchers here that I've put together in the presentation. And I would again like to thank the Voice Foundation and Dr. Nancy Solomon for inviting me to be part of this panel. And I will see some of you at the live panel on May 29th. Thank you.